Everyone, this is Dr. Naj, and I will talk to you today a little bit about endodontics, and most specifically, pulpitis. Today's video is going to be the first one in the endodontics playlist, and will be followed by other videos where I'm going to cover with you all the important things you need to know in endodontics. I hope you enjoy, and let's start. Okay, so endodontics is the branch of dentistry concerned with diseases and injuries of the soft tissues inside the tooth, meaning the dental pulp. Just a reminder that the tooth consists of four dental tissues. Three of them are hard, the enamel, dentin, and cementum. What the enamel is the tough, shiny white outer surface. Then you've got like the kind of orange, pink one, like that one is the dentin. And then you've got the cementum. These are the three hard ones. And the one deep inside, the pink one, is the pulp. And it's the soft one, and it is a soft or a non-calcified tissue. So the dental pulp is the alive portion of the tooth. It contains the nerves, blood vessels, and connective tissues that feed your tooth the vital nutrient it needs to stay healthy and function properly. You might say that the dental pulp serves as the mouth natural alarm system. If, let's say, trauma or decay is present, the pulp will experience pressure and sensitivity, which you then perceive as pain. It is the initial warning that something may be wrong with your tooth. Histologically, when we examine it, we find that it is distinguished, as you can see over here in this drawing, into four different zones. The odontogenic zone, which differentiate into a layer of dentin forming odontoblast. Here it is, number 8, like these ones. Then you've got immediately subjacent to the odontogenic zone, we've got the cell-free zone of whale. This region, as you can see, contains numerous bundles of reticular fibers, which pass from the central pulp region across the cell-free zone, number 2, the one we're talking about, and between the odontoblast, their distal ends incorporated into the matrix of the dentin layer. We also have numerous capillaries, the ones right over here. Wait, I'm going to show you the end. Wait, here they are. How are they end? And the nerves. You can also find nerves right over here in this zone. And just under the cell-free zone is the cell-rich zone, containing numerous fibroblasts, which is the predominant cell type of the pulp. Fibroblasts of the pulp have demonstrated the ability to degrade collagen as well as form it. And medial to it, to this cell-rich zone, is the deep pulp cavity that contains, number 4 right over here, that contains subodontoblastic plexus of nerves. So for you to get a better idea, I'm going to show you how a pulp actually looks like under the microscope. So this is how it actually looks like under the microscope. As you can see right like on the top, right over here, this is the odontogenic zone we already spoke about. Right over here, you can see the layer of dentin forming odontoblast. And like we said, like subjacent to it, immediately we find the cell-free zone, right? Cell-free zone meaning there are no cells in there. But like we can find just like, the fibers, etc. If you're interested, this is how capillaries look like under the microscope. And these are the fibers right over there. Yeah. Right, like we said, like we saw in the drawing, we've got right under the cell-free zone is the cell-rich zone. Here it is, containing numerous fibroblasts, which is the predominant cell type of the pulp. And right over here is the deep pulp cavity, which is medial to the cell-rich zone. So before we talk about pulpitis, let's first talk about the functions of the dental pulp. The primary function of the dental pulp, as you can see over here, is to provide vitality to the tooth, like we said at the beginning of the video. Although keep in mind that the loss of the pulp following a root canal treatment does not mean the tooth will be lost, but then just the tooth then functions without pain, but it has lost protective mechanisms that the pulp provides. The dental pulp, as you can see, also has several other functions. For example, it's inductive, meaning very early in development, the future pulp interacts with surrounding tissues and initiate tooth formation. It's also formative, meaning the odontoblast of the outer layer of the pulp organ form the dentin that surrounds and protects tertiary dentin, etc. And it's also protective, by responding to stimuli like heat, cold, pressure, caries. Like we said, like the initial alarm. Yeah. And now, pulpitis. Pulpitis, since it ends with TIS, it means inflammation, right? The inflammation of the dental pulp. And it can be either acute or chronic, and it can be caused by numerous causes like caries, traumatic exposure, fracture of the crown, thermal changes, chemical irritation, etc., depending on the classification. So, for example, if it's acute, yeah, it can be caused by caries. If it's chronic, it can be caused by previous acute pulpitis, can be caused by also caries, just like the difference is like the chronic pulpitis is going to be caused by chronic caries, and acute is going to be caused by acute caries. So, like we said, we've got acute and chronic. The acute can be either reversible or irreversible, and the chronic can be either closed or open. By open, we mean hyperplastic. So, the healthy pulp is also divided into young and old. We're going to go over this in the next videos. But for today, like our topic is inflamed pulp. So the inflamed pulp, like we said, it can be reversible. The acute one can be reversible or irreversible. And it can be caused by, like we said, caries or tooth preparation. The pain is mild to moderate and it's stimulated. It also can last only like for a couple of seconds, a couple of minutes maximum, and it's not going to hurt the patient for a long time. The irreversible, though, the pain is severe and continuous, meaning like it's the opposite of reversible. Like the patient is going to be in pain for a long amount of time, and it's not going to hurt him just for a couple of seconds or a couple of minutes. So it has little response to analgesics. This is when usually the patient comes to the dentist. When it's already irreversible, and the pain increases especially when the patient lies down. In the chronic one, though, the pain is absent. The reaction to thermal changes is reduced compared to acute pulpitis. And like we said, it's caused by either chronic dental caries or previous acute pulpitis. So the chronic one, like we said, we've got open and closed. The opened one, here it is, the chronic hyperplastic pulpitis. It can also be called pulp polyps, usually occurs in molar teeth of children and young adults, and is characterized by an overgrowth of granulomatous tissue into the carious cavity. And this is the tissue that we just spoke about. So as you can see, it's coming out from the inside of the tooth. Why did I say the inside of the tooth? Because it is necessary to differentiate it from the gingival polyp. Like this is the pulp polyp, and then you've got the gingival polyp, which is an overgrowth that has no communication whatsoever with the inside of the tooth, as you can see over here. Like it's near the tooth, but it's not inside the tooth, like pulp polyp. So gingival polyp and pulp polyps. Here you go. This is the difference between these two. The causes can be like acute or chronic. It starts like acute or chronic, opened cavity, wide apical foramen in children. Yeah, so the clinical features is the absence of spontaneous pain because it's chronic, like we said. Possibility of a history of spontaneous pain when it was acute, most common in deciduous molars, like we said earlier, and the radiological signs as absence or slight thickening of the periodontal ligament. That is basically it. And I hope you liked today's video. If you did, please make sure to share it and subscribe for more videos on endodontics.